We've seen a lot of exciting advances just happen in the past 2 to 3 years in the treatment landscape for lung cancer. We've seen trials with immunotherapy improve survival in patients with stage 4 disease. We've seen EGFR and ALK inhibitors. Now more targeted approaches against RET and MET are being reported on, and we hope these drugs will become available. What I'm looking forward to is how are these drugs going to fare in the curative setting, be it immunotherapy or targeted approaches, and there are ongoing studies for patients with early stage disease. The results of the Pacific trial, which showed that durvalumab improved survival rate for patients with locally advanced disease, I think is the first success we've seen in the curative setting. We want to see some of these other trials like the Alchemist and the other adjuvant TKI trials read out in the upcoming years, and hopefully that will help us cure patients with lung cancer, which is what we're all aspiring for.
It's hard to know what studies are going to be reported in the next year, but generally speaking, studies that I'm interested in are those that are using immunotherapy during the chemoradiation part for patients with stage 3 disease. It's a huge unanswered question. There's lots of little unanswered questions, but this one's one of the big ones. Should we have immunotherapy on board? And then there's all sorts of other sequencing questions to ask as well. Should we start with immunotherapy before we deliver the first round of radiation, or vice versa, or concurrently? These questions require a lot of resources, a lot of physician and patient commitment, a lot of time. I know time's not always on our hands. A lot of patients are getting diagnosed with this awful disease. But yeah, those are the questions that keep me up at night.
I'm interested to see the manuscript for 213. I don't know if we're actually going to get that in 2019 or not. I'm also interested in seeing some of the additional studies about PARP and upfront maintenance in non-BRCA carriers come out. I think that could really be a field-changing data.
I definitely want to know what the results are from Velia, from Prima, from Paula. Those have the chance of changing the standard of care for upfront ovary cancer, for expanding that PARP maintenance to women other than BRCA mutated patients.
I think we're really eagerly waiting the details of the Griffin study, which is not just the high-level data, but what are the true responses, the toxicity profiles, the stem cell collection, and to really shed light on that. And I think also a big question would be high-risk patients. Again, this is a relatively small study, but those are some of the questions being, I think, asked, and that'll be really great information to have. I think the other study that we're also eagerly awaiting is the American version of the Dana-Farber IFM collaboration. And the big difference here is Len was used till progression as opposed to the French fixed duration of lenalidomide. And that's going to be important in understanding the role of transplant in 2019. And if you use efficacious induction and effective maintenance therapy, what is the role of transplant? So that's also very important data that we'd all love to hear.
So far we've heard a lot about BB2121, the 21217, plus the JCAR, and the Poseida's compound 101. We haven't heard anything from the phase 1B Janssen trial, the CAR-T that they have acquired from China. We have heard Legend 2 stuff, information on the Legend 2, but we haven't heard on the actual phase 1B conducted in the US. So we're hoping to hear the data come out either at ASH this year or early next year. So I think that'll be the most exciting to see as another competitor how the data is going to turn out.
So this year, I think the readouts from the early phase clinical trials for the different bispecific agents and the different CAR-T strategies, I think there's going to be a lot of talks at ASH this year about that. And I think it's important not just to look at the upfront response rate, but to look at the progression-free survival data and the side effects profiles, because that's a not insignificant part of the picture. Both of these types of therapies are very promising, but they're a big commitment for the patients. They're a big commitment for the institutions in terms of delivering those therapies. I think that the other set of trials that are of great interest are the clinical trials that are moving DARA to frontline therapy. I think so. There was one report at ASCO this year for the MAIA trial, which suggested that, again, the upfront response rate may be better and deeper in DARA-containing quadruplet regimens than conventional triplet regimens. But the long-term follow-up is really going to tell the tale on these, because it's not just how long is that first remission, but maybe how long is the second remission, and what can you give that's going to be effective in that second remission. Because the success that we enjoy now in myeloma is the result of two things. One is we have better induction, consolidation, and maintenance therapy. But two is we also have much better options available for us for relapse therapy. But if we move all of those into the front line, we lose those on the back end. So overall survival, in my opinion, is still an important metric for outcome.
In ALL, I would say we are very interested in the SWOG study, long-term outcomes for blinatumomab upfront therapy for elderly patients. We are excited about the venetoclax trial. I mentioned about the combination of navitoclax with venetoclax, which is an ongoing study for refractory ALL, which I think will turn out to be a very active regimen in this setting. Like I said, there are novel CAR T cells which we are exploring. There is another antibody called flotusimab, which we are proposing a trial. It's a CD123 bispecific, so we are interested in seeing those results. The AL studies have not begun yet, but we are excited about that agent as well.
I would say that there's not one study that carries more importance than the spectrum of all the studies that have shown these remarkable advances in biologic treatments.